So, for several decades, Fiona had lived with the consequences of injuries that she believed had been long since healed. Her story began when she was 21, when she broke her left ankle, and which required surgery. And now, at the age of 32, she sustained a cruciate ligament injury, as you can see here, which was repaired using a tendon graft. For many years, neither injury caused significant problems, but as Fiona approached her 70s, pain, swelling, and instability gradually began to affect her daily life and her joints. Her left ankle had sort of developed significant arthritis, while both knees and her right leg sort of ended up becoming painful after prolonged standing. As an artist, Fiona has sort of often spent hours on her feet painting murals. And also, she cared for her young grandchildren, which involves lifting, as we know, walking, and remaining active throughout the day. And she became increasingly aware that her gait felt uneven, so she was also always unsteady. And standing on her left leg was difficult, and she couldn't rise onto the ball of her feet, especially on her around her left foot area. So she was told that she needs an ankle fusion, to fuse this ankle joint here. And she was told that it might be necessary, while also awaiting further assessments of her knee. Now, before considering surgery, Fiona wanted to understand the root cause of why this is happening. When she underwent the EOS scan, as you can see here, both images, the focus was not just on the painful area of her knees, and consequently her ankle, but also on how her spine, ended up sort of being affected by the pelvis, and how the legs work together with keeping her upright in that position. Now, the scan showed her posture was generally balanced with no major structural abnormality. However, her body was making several small adjustments linked to her previous injuries with the ankle and the knees. And her pelvis sort of tilted backwards slightly, as you can see on this image here, it's slightly tilted backwards. And we know this from her data. And sat a little higher on one side, as you can see, it's slightly twisted, her pelvis, than compared to the other. So while her hips and knees ended up helping compensate for a general forward lean, so she was gently forward leaning. So the legs also showed a subtle side-to-side difference, although her actual bone lengths were almost identical. Now, for Fiona, the pieces started to come together after she had an EOS scan. The findings suggested that her symptoms were not being caused by one major skeletal problem, but by the way her whole body had gradually adapted around the old ankle and sort of the knee injuries and the surgery. So rather than simply accepting that surgery was the next step, Fiona now had a clearer explanation and a more informed basis for exploring insoles, strengthening, movement work, and other non-surgical options before deciding how to move forward, as with most of our patients. Now, if surgery was still required, we were confident that the new data would help the surgeon plan her surgery much better for better outcomes.